I have several treatment philosophies, but the one that comes to mind as being the most important and the one that I really try to teach my trainees and my students is that you have to work with that family as a team. Really, in order for all of us to best take care of that child, we have to work together. So one of the things I really try to do in the clinical setting is make sure that the family's comfortable with my treatment plan. So I'll ask them, are you comfortable with these medications? Have you heard of them before? What concerns do you have? And in that way, I know that they're comfortable with what I'm doing. They'll be able to carry that out at home in order for both of us to make their child feel better. I see children with all types of breathing problems and respiratory disorders, from cystic fibrosis to asthma to chronic cough, which is very common in children. I would say that my clinical focus has been specifically pediatric severe asthma and difficult to treat asthma. Part of what's very exciting about MUSC now is the state of growth that it's in, and really that's part of why I came back, to take part of the new children's hospital that's being built, the new children's medical office building that's coming up in a few years. If you think about children's health care, one of the most common healthcare problems in children is actually respiratory disease. So what I've noticed is that not only within my own division of pulmonology, the whole hospital, the other divisions and departments are supporting that growth within pulmonology, so that's very exciting for me. I actually went here for medical school at MUSC. I graduated in the year 2000, and I left for several years after that. I went on to the University of Connecticut to get my pediatric training. I then went on to the Children's Hospital of Pittsburgh to get my pulmonology training, and I stayed there as a faculty member for several years. For me, I always knew that I would eventually make my way back here to MUSC. My parents actually live in this area. But it was important for me to go away and develop a specific skill set and expertise in pediatric pulmonology that I could then bring back home. So part of why I came back is actually to build a state-of-the-art pediatric pulmonology program, and one of the things I often talk about to families is my experience and my skill set that I brought from other programs.